Hey everyone, welcome back to Autism Uprooted with BioNexus Health. I'm Dr. Jodie Dashore, as you all know. So today, let's continue with point number 5 on the main topic as to, why is my child not feeling better or not getting better? So let's go right ahead with it, shall we?
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Number 5 is time, not giving the protocol enough time, giving up too early. The important points to remember are time, patience, trust, faith in yourself, self-confidence in yourself, that you will be able to heal your child because you're being given all the guidance that can possibly be given. It's evidence-based. We've run labs. Now, those are very much your child's labs. The protocol is completely customized to your child. So everything that could have been done is being done. And you just need time, you need patience for the infections, the toxins, the environmental issues to be handled by the herbal protocol, right? That makes sense? Because, it's a completely natural, plant-based, non-invasive protocol. And the one thing that it does help children, provided the other issues or the other points that I've mentioned in why is your child not getting better, the exposure, the travel, etc. Those have to be listened to as well. Don't just listen to this podcast and then forget about the first 4 points. So this is kind of, the cherry on top. I'm giving you a few final words on how to keep going, how to stay motivated. It is important to educate yourself on what PANDAS, biotoxin illness, Lyme disease, infections, environmental toxins, mycotoxins, mold. What is all this? And, what does it do to a human body? And also understand that it takes time. I know I keep saying that, but it's very important that it sinks in. Many children are, 5 years old, some are 7, 9, 14. That's when you find your way to me. And that's when we run the labs and I customize the protocol for your child. Now, understand that the labs that we ran, the underlying medical issues that we saw, 2 things to understand very carefully. One is that, say, for example, I'm seeing your child when the child is 5 years old. Okay, 5 years is a good age. You can absolutely see tremendous amount of improvement. But why does it take time? Because for 5 years, all of these toxins have accumulated. Any kind of genetic predisposition has been activated. The immune system, your adaptive and your innate, both the branches of your immune system have been compromised. So these things have been going on for years. So you cannot expect to recover in weeks or even months, right? So then the question is going to be, well, Dr. Dashore, what about some of the videos that I have shared, meaning myself, have shared on the Autism Uprooted podcast from parents whose childs have had really good improvement? Well, of course. I mean, because every family situation is different. Every child's, level of toxicity is different. The country is different. So obviously, climate issues, mold issues, insect bites, infections, environmental toxins, these things are going to vary based on which country you're from. One example is, I have a child whose family had already researched prior to contacting me about what is biotoxin illness, what is PANDAS, etc. Like mom and dad had, mom's actually a nurse, so that was kind of helpful, like being in the medical profession. So they had researched, they had already called in an environmental professional to make sure that they kind of set the ball rolling. And all these things were in place: the mold inspection, the air purifiers, the wipe down protocols that I've given every one of you. Front loading washing machines were thrown out, the old ones with the mold. So a lot of this groundwork was already done, right, before we started with the child. And then you will see that the child has made dramatic improvements. So within a few months, I've had some children that have, started saying words, have calmed down, the hyperactivity is gone, the focus is better, and then things keep improving from there on, right? Academically, you get great reports from school. So that's really fantastic. Just last week, I heard from a mom that the child had transitioned to mainstream classes, no more autism classroom or special needs teachers and what have you. Now, this didn't happen overnight, right? Jacob has been on the protocol for 14 months, has showed steady improvements. And now finally he's been transitioned to mainstream, and he was moderate. He wasn't, a severe case, a young kid, like when I saw him, he was 6.5 when I first started with him. So by the time he was in the next grade, the evaluation team at school deemed that he was, ready to be mainstreamed. So, right now, this is talking about a child in the United States where resources and facilities and diet is absolutely top notch. Like some of the labs that are available in the United States for biotoxin illness, those are not available elsewhere. But, we use alternative labs to the best of our capability, and we try to narrow down where the issue is with your child, those of you who are living outside of the United States. So keep that in mind. It's very important to educate yourself just exactly what is PANDAS, biotoxin illness, so you grasp the matter correctly. So you grasp the gravity of the situation. We are not talking about cough, cold, flu. We're talking huge medical issues that affect multiple organ systems, right? Again, revisit your child's labs. You are all given copies after the labs review, after I've explained what the labs really mean. So you have that medical professional explanation along with the actual report, and I usually send you a physician's copy. So the explanation is once again in the lab report as well, right? So please take the time to read that. One very important perspective that you need to have is to understand that even if this was a neurotypical person of any age, an adult, an NT child, with the kind of labs that we see with our children on the spectrum, that is a tremendous burden on the body of any person, any human being, and it is going to take time. If you look on online support groups, etc., you will find thousands of neurotypical patients that go through the same issues that your child on the spectrum is going, not the same, obviously, you know what I mean, like, similar issues as your child on the autism spectrum. And it takes them years to recover. And why does that happen? Because many of the infections and most of the environmental toxins they kind of burrow in deep into the tissues. So if they are deep inside the cells, deep inside the tissues, it becomes a multi-step process, doesn't it? Because when you have toxins, infections, they cause physiological and biochemical changes in the body. We run those labs as well, and you have the results. So all of those changes in the blood work, in the various organ systems and detoxification, so all of those changes have to be corrected. We need to repair any damage that has been caused, whatever can be repaired. There is no absolutes. No one can go back to 100%. Now, even Brian, I've explained this to most of you, is at most good days is 95%. Myself, I don't know what, maybe 80, 85% so far. I didn't really start focusing on myself. I've been through biotoxin illness as well as several. I had 19 co-infections when I first evaluated myself. So, it's like peeling an onion, isn't it? Layers of an onion. Little by little, you unravel what's underneath the real you. And that's been happening. I feel great, everything's going well, but I'm certainly not 100%. I'm not even 90% most days. Some days are better than the others, but I'm just grateful, and I feel blessed for whatever good health I have been given. This whole mystery with myself was unraveled because I looked into, I was very stubborn and determined to heal my son. And I refused to just kind of buy the diagnosis that, hey, it's autism, so it's lifelong. You and the family have this life sentence now. That's it. Deal with it, give him some support, keep him happy. What nonsense. My heart did not buy it. And I'm glad those of you who have reached out, have felt the same pull in your heart that, hey, my child can improve. And once again, the labs belong to your child. Understand what's going on in that poor little body. The yelling, the screaming, the behavioral issues, the picky eating. If you look at the labs, it makes a lot of sense, right? Brain on fire, gut on fire. What is the child going to do, especially if nonverbal? How are they going to explain? Imagine yourself going through all of those issues. Actually, if you pause and think about it, you are probably going through very similar issues that your child is going through, isn't it? Because you're in the same environment. Oftentimes, it is passed in utero to the child. And I have many patients on my caseload where siblings are being treated, even though they are not autistic. Some siblings are on the spectrum as well, but there are other siblings that have other issues like ADHD or severe eczema, severe asthma, allergies, gut complaints, IBS issues, not gaining weight, brain fog, right? So all of these symptoms are much, much milder form of what your child is going through. Also mom and dad, in fact, grandparents as well. So discovering what's going on with your autistic child medically and environmentally benefits the whole family if you have the right attitude about it. The wrong attitude exists as well, doesn't it? Many of you have told me that, sometimes there is yelling and screaming going on at home, trying to, physically punish the child because of behaviors that he cannot control. And, that doesn't really serve any purpose, does it? I understand everybody gets frustrated and upset. You should take a step back and realize that you yourself have probably been affected, right? You have a mature immune system. Your immune system is not going to give you all of the symptoms that your child on the spectrum is experiencing. But if you take a step back and take stock, analyze what's going on with you, memory issues, brain fog, decision making, being able to analyze the situation, being able to control your emotions, control your anger, being patient, being able to control your frustration to reasonable levels. I'm not saying you have to be a saint, but no, that's obviously not possible, but to reasonable levels, so that you can help yourself, your family, and your child to the best of your ability. Now, if that's not happening, then it might be interesting if you are able to run some labs on yourself and see what's going on. Many have, as I mentioned, many have. I've got 2.5-year-olds feeling better, and then I've got 78-year-old grandma feeling better. So it's absolutely amazing what natural medicine can do. All age groups benefit because it's plant-based, it's all natural, it's biodynamic, which is beyond organic. You can take your time, you can build up. So, what's to lose? There's only gain. That brings me to something. I heard from a couple patients, more than a couple, that sometimes family members don't cooperate. They don't believe. Now, this typically happens in the beginning until the lab results come back. And then once the lab results are revealed, it's black and white. Hand it over to the disruptive family members and say, hey, look at the labs. And it definitely takes time to resolve all of these medical issues. Now, let's look at it from another perspective, right? Take it up a notch. If this was happening to a neurotypical person, it does happen, like I said, in thousands on support groups online that go through similar issues. Everybody, when treated for it and when given the appropriate amount of time to heal the body and the appropriate kind of treatment, everybody recovers and feels better. I know it takes some a really long time. I'm aware that there are some, for various reasons, underlying issues, age, etc. How long before they seek help? They don't get better very easily. But your child on the spectrum is young, is being given a beautiful, beautifully customized, individualized, biologically individualized, all natural, biodynamic protocol. And there are all of these medical issues going on. And once we clean the toxins, we detox, we do cleansing, we do repair, we kill off the infections, right? How can there not be improvement? And if you're not seeing improvement, then again, all the 5 points that I've mentioned in this particular series, why is your child not getting better? The top 5 reasons. Go back and revisit all this is the 5th video in the series. So go back and revisit those and unravel as to why your child is not getting better, right? But patience should not be an issue. Please be patient, right? Patience is a virtue. And, and keep the atmosphere at home as peaceful and as happy as humanly possible. I understand it's very challenging to be an autism mom, to be a special needs parent. But I think, all the parents that reach out to me are absolutely amazing. You guys are all willing to take it to the next level. Just you're all in. You want to help your child improve, and I applaud you for that. So don't be too hard on yourself. Everyone has good days and bad days, but give yourself and your child a chance. Be patient. Trust in your practitioner. Reach out if you have any questions. I'm going to be having several webinars to help you. There's one webinar coming up for any Q&A that you guys might have about die-off reactions that I haven't perhaps haven't addressed in my die-off video. So by all means, feel free to tune in and join that webinar. I'm happy to answer your questions. Okay. So be patient, be happy, have faith in your child, have faith in yourself that things will get better. There's definitely light at the end of the tunnel. All right, I'll see you guys back here next time. I'm going to stop here. And, I'm glad you guys were able to join. Please remember to subscribe, and I'll see you soon. All right. Bye for now. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.